you need to have the balance.
You need to have the balance, yes. Communication for nurses, it's really important. They can, from my point of view, it's very strict. What is it? Why is he on this medication? Why is he on that medication? And one thing, you need to have patience. Nursing, it's not easy.
Hi guys, hello, welcome back to another video. This is your KapsLock. We are back with another video. And first of all, thank you so much, Jashanpreet ji. We have Jashanpreet here, and she has been doing a Bachelor of Nursing from RMIT University for past 2.5 years, 2 years?
Yeah, so it's my second year.
Okay,
yeah.
So second year. And we have her here because the topic is great, which is called nursing. So there's so many misconceptions out there. There's so many problems out there. और ये वीडियो मैं हिंदी इंग्लिश मिक्स में रखने वाला हूँ क्योंकि मुझे लगता है कि लोगों को दोनों तरीके के पॉडकास्ट होने चाहिए. एंड इफ यू वांट दिस वीडियो इन इंग्लिश यू कैन चेंज द सेटिंग ऑन यूट्यूब एंड यू कैन लिसन टू इट विद अ सेक्शन कॉल्ड ऑडियो डब टू इंग्लिश एंड वी हैव सबटाइटल्स. और अदरवाइज अगर आप चाहते हैं कि मैं ये वीडियो इंग्लिश में बनाऊं सो कमेंट करिएगा, मैं इनको बुला लूंगा इफ शी इज फ्री. ओके, सो जशनप्रीत, फर्स्ट ऑफ ऑल एज आई मेंशन, थैंक यू सो मच, आप आए अपना टाइम लेकर के. And we are talking on nursing today, and मैंने बताया कि you have been doing in this field a lot. So let's start. थोड़ा सा अगर आप मुझे अपने background, if you can tell me more about your background and why nursing.
Why nursing?
So why did you choose nursing as a career?
I wanted to be a dentist, right? And I came to Australia in Biomedical Science, and because of the consultant. The consultant said, go in Biomedical Science, you'll get a PR, and then do dentistry after that.
Mm-hmm.
But when I came to Australia, I got to know there's no PR in biomedical science.
Sorry.
You know the consultants.
Sorry, ये बहुत ज़्यादा इन्होंने bluntly बोल दिया है, but I wasn't expecting it. Okay, ठीक है.
But then I changed to nursing by myself.
Mm-hmm.
But that's how I came to nursing. Yeah, to get the PR and do dentistry.
Okay. But do you like this field? आपको पसंद है?
I do like this field. So when I was changing my course from biomedical science to nursing, I did a Cert 3 course for individual support where you can work in aged care and disability. And I started working there. I did some placements and then I was like, yeah, I like it.
Okay.
Like, yeah, I like taking care of people.
Why Australia for nursing instead of your home country or other countries? आप बताना चाहें इस बारे में. हिंदी रखते हैं, अब हिंदी रखते हैं.
मैं थोड़ी सी एवरेज हूँ पढ़ाई में, ठीक है.
क्या ही जवाब दिया है, वाह.
बट इंडिया में कंपटीशन बहुत ज्यादा है.
I agree.
नीट क्लियर करते करते आपकी जान निकल जाती है. लोग चार
डॉक्टर, राइट?
Like I wanted to be a dentist. I told you.
तो dentist becomes like dentist is a specialist of teeth.
Yes.
And that becomes
so
after doing law.
BDS.
Okay.
Bachelor's of Dental Science.
Mm-hmm.
And either you can do BDS or you do MBBS.
Mm-hmm.
Yeah, I don't know much about that. I just know these two things. So, competition बहुत ज़्यादा है. मैंने नीट दिया, मेरा क्लियर नहीं हुआ. मतलब I qualified, but जो कॉलेज में मेरे को एडमिशन चाहिए था वहाँ नहीं हुआ. कोई अच्छी जगह. तो it was like मेरा पहले से ही प्लान था कि बाहर आना है. Plus I had some relatives in Australia as well.
Okay.
So I was like, why not? I'll just join them here, and then do nursing, explore the world, explore the country, new culture. Yeah.
You're studying in RMIT?
Yes.
Okay, इसके बारे में मुझे बात करनी है कि why did you choose RMIT if you can tell us? और other university जो आपने सोची थी कि you would choose it?
I was gonna go in Deakin before, Deakin and RMIT. I had these two options.
Okay.
I chose La Trobe as well.
Mm-hmm.
But La Trobe, जब तक मैंने अप्लाई करना शुरू किया तब तक उसकी सीट्स फुल हो चुकी थी. तो it just vanished. So I got offer from Deakin and RMIT. Deakin, I didn't choose it because I was living with my auntie and it was far from her place. And RMIT is much closer too. So I was like, why not? Just RMIT. Plus, I like the flexibility as well. Deakin, from my point of view, it's very strict.
Deakin?
Yeah, as compared to RMIT, RMIT is very flexible. It's very flexible.
See, being honest, मैंने कुछ लोगों को डीकन में फिर भी पास होता हुआ देखा, बट on those particular fields, RMIT fail कर देता है. Being
Yeah.
honest. Nursing का I don't know because I'm not in the field, but you, as you
A lot
mentioned.
of people that fail nursing.
So मतलब तो फिर तो strict ये भी हुआ.
But in assignment point of view,
Okay.
you fail in practicals, you fail in placements because it's your skills. You're not showing it properly. For assignments and exams, RMIT ज़्यादा flexible है.
Understand.
Like अगर आप assignment नहीं submit कर पा रहे because you're working or you're sick, you just get the extension without any reason. You just don't have to submit any reason and like give you extension for 2-3 days. And if there is a reason, they give you for a week. Yeah.
Okay. Well, of course, it's a brief question. Do you have any previous healthcare experience before starting this course?
Before nursing, as I told you, I did the
Bio.
No. The Cert 3. Cert 3 in individual support in aged care. So that's how it linked with nursing. I was very questionable for nursing if I should go for it. But when I started working in aged care, I was like, nah, I think that's my kind
of goal. Okay.
Yeah.
Well, now the major Venn diagram, nursing, course structure, and learning. So I would love to know, or the audience would love to know more about something that's not present on the website, which is what do they teach? What's the exact course structure of this study? What do they teach in this course?
So it's a mixture of all of things: labs, practicals, theory, assignments, clinical placements, everything. It's just that आपको उससे उसके जो नर्सिंग के अंदर जो चीजें हो रही हैं उससे एक्सपोज कराते हैं. ठीक है,
जो करंट बेसिस पे हो रही हैं वो
जो करंट बेसिस पे हो रही हैं
इन हॉस्पिटल्स
लाइक करंटली तो जा रहे हैं. अभी जो चीज रिसेंटली चल रही है, वी गो टू हॉस्पिटल फॉर प्लेसमेंट्स, वी गेट टू नो लॉट ऑफ थिंग्स. एक पेशेंट एक केस स्टडी है, like on its own.
Understandable.
So whenever we go on placements, there's just this goal that they give us that you have to choose one focused patient, research about that patient, get to know what he has, what he or she has, what is it, why is he on this medication, why is he on that medication, why can't he have this, why can't he have that.
Do you get guidance as well? अगर आपको कोई चीज समझ में नहीं आई बीच में तो आप पूछ सकते हैं.
हाँ, there are clinical nurse educator at the placements, so you can go to them anytime. They are happy to teach you. What
subjects or skills are exactly like most important in this study? Pharmacology. Means दवाइयों के बारे में?
Yes.
Okay.
दवाइयों के बारे में. I passed that subject, so I'm a bit relaxed. But it's pharmacology, and you need to have your hand skills and communication skills. Communication for nurses, it's really important. If you can't communicate with a patient, you can't do anything with them.
Understandable.
Like there are some dementia people, right?
Which people?
Dementia.
Okay.
That they can't remember things.
Mm-hmm.
They forget easily. So with them, they're like, we want to go to the toilet. That's how they say, right? And then when they stand up, they forget. I had to go to the toilet.
तो फिर आपको कैसे पता चलेगा?
So we just guide them, like, let's go. I'll take you to the toilet. Yeah, I have to go to the toilet. Yeah, you have to go to the toilet. Let's go.
Okay.
Some people refuse medications. Some people refuse to talk. Like, I don't want to talk. If you're not friendly with them, you're not making them comfortable with you, they won't tell you anything. Where are they having the pain? Where are they having the pain? Are they eating much? Are they doing anything? जब तक आप अपनी रिलेशनशिप नहीं बनाओगे अपने पेशेंट्स के साथ, तब तक आप उनकी केयर नहीं कर सकते. That's what.
मुझे एक चीज में इसमें थोड़ा सा कंफ्यूजन है. So नर्सिंग एक फील्ड है जो एज केयर में भी जाती है और जो नॉर्मल
हॉस्पिटल्स में भी जाती है और नॉर्मल के लिए जाती है. हर फील्ड में जाती है.
ठीक है. सो इस स्टडी के अंदर क्या हमें स्पेशलाइजेशन करने का ऑप्शन दिया था कि आपको किस में जाना है, आपको एज केयर में जाना है या फिर आपको या फिर बस वो पढ़ाते सेम ही है, फिर आपके ऊपर आप कहीं भी जा सकते हो?
जो मेरा प्लान है, because when I started nursing, the plan changed, right? And उसमें you can't choose a specialization. I think so. I'm not sure. It's the next year thing. But जो हमसे पहले थे, 1-2 साल पहले, उनके लिए there was options that you can choose your specialization if you want to at the last semester, so that their placement can be related to that.
Okay.
That they'll have more experience on the particular ward. If they want to work in ICU, if they want to work in theatre, if they want to work in cardiac, if they want to work in renal, it's all different. Yeah.
Understandable.
Yeah. Aged care is totally your choice. For being a nurse in aged care, there's not many skills that's required in there, but it's easy. As what I think.
That's for your opinion.
From my opinion, nurses working in aged care, they have a bit easy-going schedule, but it's monotonous because it's every day. It's the same thing, same routine, same medications, same patients, same residents.
Unless something happens suddenly.
Yeah.
Okay.
They know what's going to happen, so they're already prepared for it. There's nothing suddenly that's going to happen there.
How often do you have clinical placements?
For the first year, you have placement after the second semester.
Okay.
Earlier, there used to be a placement after first semester, the aged care one.
Sorry.
That's okay. You're tired. You give me the copy.
No, that's fine.
So they removed that aged care placement because you learn more of a PCA work, not the nurse's job, because you work there with the PCAs, not with the nurses.
Means?
The personal care workers, sorry. Personal care workers, PCA, personal care assistants.
Oh.
Yeah.
So how different is studying nursing in Australia compared to back home?
From what I have observed here, you have classes like 1 or 2 days, right? You have labs just on 1 day per week. But in India, you go every day, Monday to Friday, 8 to 3, in uni, in college, studying.
Mm-hmm.
Studying or in the hospitals, at their placements, at their work. They have a lot of shifts. They are like, from my point, what I think is they are more experienced than what we are here.
Okay.
But yeah.
But ये भी है कि इसमें एक point ये भी कि supply and demand matters.
हो सकता है.
But I would say nursing में demand हमेशा रहती है, especially after COVID.
After COVID.
What I understood at least. Maybe you have a different opinion.
COVID के बाद nurses की बहुत जरूरत पड़ी है. यहाँ पे पड़ी तो है. There was a hike as well. Students की भी और साथ के साथ nurses PR, and then in COVID as well, the students that were studying nursing, they also got a job as a nurse in
Hospitals.
Yeah. They were working there. They were earning like a nurse, even if they haven't studied. Like, I know a few people that have done that. They just took admission and then they went to work in COVID.
Wow.
They were paying like crazy.
So, placements and practical experience. What was your first placement experience like?
My first placement in nursing, right? Yes. So it was rehab center. It was, I don't want to say the hospital's name, sorry.
Oh, that's fine.
Where they are like, basically there are old people, the old people there have came from aged care, but something happened to them. They're here in the hospital. The nurses are looking after them. They are there for like 2-3 weeks already. Some are there for 5 weeks in the hospital. Like they keep monitoring them. कि क्या चल रहा है इनकी
healthcare
कि health कैसी चल रही है.
Okay.
And then are they deteriorating और कि ठीक हो रहे हैं, वो चीज सब नोटिस करते हैं नर्सेज के अंदर, क्योंकि एज केयर में तो वो PCA के साथ चल रहे हैं. नर्सेज भी हैं, बट एक नर्स के अंदर there are like 60 residents, so she can't, right?
Understand.
So here in the rehab, they just have like 5 patients under them, the nurses. It was good, as I have worked in aged care, so it was pretty much the same because we couldn't do the medications in the first year. We learned the pharmacology in second year, first semester. So after that, we could do the medications, but yeah, we couldn't. But after the first year, in my second placement, we did the medications. I gave a lot of injections.
I don't like syringes, being honest.
I like giving the injections to the people.
Please. Okay. So, Do placements help in getting job?
Yeah, I have a lot of my friends, my classmates, my course mates. They got a lot of They got jobs in aged care. They got jobs in agency. That's because of the placement experience. Yeah. They also give their references. They're educators, nurse educators there. They give your email and phone number so that we can put it our reference to work in any aged care or related kind of stuff. Yeah, they're helpful. Yeah.
How do you manage placements with your part-time work and studies?
So, as I told, I work in aged care. I'm a permanent part-time there. So I have permanent shifts. Like every Saturday, Sunday, it's fixed.
How many hours?
I work like 43 hours per fortnight in aged care. So Saturday, Sundays, and few days in the week, like alternate Tuesday, Thursdays, like that.
What's your role there?
Huh?
PCA.
PCA.
Sorry.
Yeah. Personal care assistant. We say PCW, personal care worker, W for worker, A for assistant.
Balance कैसे करते हो आप study?
Balance. I usually have morning shifts on weekends. So after 3, I'm free.
You have time.
I have time. Yeah. Even if I work during the week, I work in the afternoon sometimes. I work in the morning sometimes. So I have half of the day free for me to do anything.
How far do you live from your uni? Where do you live?
I live in Croydon.
So it's way far away?
It's way far away.
From your university?
Yeah.
How do you manage?
I had a rental car before. So I used to drive to uni. But
Used to?
No, I don't drive anymore to uni because the owner of the car, she sold it. Well, she's going to sell it. But
she took it out.
Yeah,
okay.
But no, she didn't. I use it on the weekends, but I don't use it to go to uni. I kept my classes all on one day, so I'll go in the morning,
and in the night you're dead.
Huh?
And in the night you're almost dead because you're having these many classes all day.
Yeah, because after my classes finish at like 5:30, and then all of our friends, we go out and play pool.
Stress buster.
Stress busting. That's really important. Otherwise, you're gonna yeah.
You need to have the balance.
You need to have the balance. Yes.
Have you faced any cultural or communication challenges in your hospitals?
In hospitals, yes.
Want to speak on it?
Well, it's the patients, right? I was working in. I had the placement in rehab, so all the patients, like majority of the patients, they were like Arabic speaking background. They were old. They forgot how to speak English now. So it was really hard to communicate with them. Like, it's your medication. You don't want to eat that. What else do you want to eat? Right. But there are a few words that's similar to Hindi. Right. And then I picked up when I was talking to her. I was like, do you want honey? She said, yeah, I want honey. She said, butter? Yeah, honey and butter on the bread. And that's how it's a bit challenging. Like, if you don't know, you don't know. Right?
So it's more like कि अगर आप communicative हो सकते हो तो it's good so that you can learn and you can do your
उनके
job.
पास options भी हैं. हमें nursing में सिखाते हैं कि there are like photos of different things. ठीक है, guides हैं, like sheets हैं जिसमें आपको दिखा रहे हैं, अलग-अलग facial expressions हैं, अलग-अलग like एक bodies भी बनी हुई हैं कि जिसमें you can point out in which area you're having pain. So it's really helpful for them. They're like patients that can't speak, right?
So how do you manage?
You don't know people who can't speak.
No. How do you manage in your hospitals? I know people.
It's just the communication is just all on the paper then, like or the family members.
लिख करके.
Yeah, लिख करके. You can tell.
Well, back to the topic.
Back to the topic. Yes.
So,
sorry.
Career opportunities and PR pathways. Here come the best part. So, what are the job prospects for nursing school graduates in Australia? What do you know?
बहुत options. You can go anywhere. Like for grad nurses, it's like a bit challenging because आप नए nurse बने हो, right? There's no one to supervise you.
So what do you do?
But they still have few shifts in whenever you go to hospital. If you got a job there, There are a few shifts that they do buddy shifts with the nurses. Like that's how the routine of the hospital is. And then you have to be independent. You have to do it by yourself.
Any day, obviously.
Yeah.
I understand.
One day. There's going to be one day.
Yes, yes.
Right.
Does nursing still have good PR demand in 2025 or maybe 2026? Yes. I knew this answer already.
Yeah. When I was doing my placements, right? And then I did in June.
Yep.
And I was talking to that clinical educator and she said, you know what? Just join our hospital. Whenever you finish your grad nursing, I'll hire you. I was like, okay. Because we are very short-staffed.
What's the starting pay range for graduate nurses or something that you want to tell?
For grad nurses, it's a bit low, but with experience,
How much is it?
it's 35. It starts from 35.
35 is low.
I work in an aged care and that's 35.
How far can it go?
It can go on public holidays. It's like above 100.
Why am I making YouTube? I should be a nurse. Please teach me.
In COVID, I know some person. They were working as an RN.
Registered
Right?
nurse.
Yeah, registered nurse. So after the bachelor's, you become an RN, right? And they were getting paid $120 per hour, $120 or $130 per hour in COVID, just to be there, sit with the patient, and do nothing.
Time to join nursing. Okay. Are there more opportunities in metro hospitals or regional areas? Which one is better?
Well, I haven't been much to the
City?
hospitals.
Oh,
To be
okay.
honest, I have just had 2 placements. One was in rehab, that was kind of like an aged care.
Okay.
So I just had one placement that was in an acute. No, I was going to say the hospital name again. Yeah, it was all right. There was like a lot of nurses, but they were saying that they do get short-staffed.
Okay.
Sorry, what was the question again?
So
I got off
it's
track.
fine. More opportunities in metro hospitals or regional hospitals?
In both.
In both?
Yeah,
Okay, it's a demand.
yeah,
Okay.
in both.
Well, life as a nursing international student, how intense is the workload? If you want to keep it brief, you can brief it.
Intense.
Like
It is
workload means
intense.
balancing theory, assignments, placements.
It is intense. It is intense. Yes.
So you manage it good?
Yes. That's why touch wood, I'm passing all the subjects.
What's the support like from lecturers or clinical supervisors?
Oh, there's a lot of support.
From lecturers as well?
Yes.
They help it?
Yes. They're like, if you're in second year, they're like third-year students that are there for you to help.
Even
Even the students, yes.
Nice.
Even I got the opportunity to be a mentor for the subjects that I have already done for the students that are currently studying. But I choose not to because I had work. I'm sorry. But I did help my course mates to go through that subject and how to do it.
She'll be like, "Nah, I'm busy. Go away."
No. I did help a lot, to be honest. Yes. You can ask anyone.
Okay. We need to find people and ask, okay? Well, how easy it is to make friends in this program?
Oh, RMIT offers a lot of programs and events that way you
make
can
friends.
go.
Yes, you can
enjoy.
go. meet them.
Yeah.
Especially in RMIT, just in general. Is it easy to make friends?
Yeah, it's really easy to make friends. Yes.
In
I
Australia?
was doing biomedical science. There were hardly any Indian students in the biomedical science in my class. I did it for an year and I just saw like one Indian student in there and rest all were Aussies.
Well, it's
And
fine.
I did
If you want
yeah.
to make friends, you can make Aussie, you can make
Yeah.
Chinese, you can make Indian, anyone
Like,
you can make a friend.
You know, when there's an Indian person in front of you, it's much easier to make the connection. And those
That's why we
the
are
domestic students here, they're from the same schools from the back, and then they're joining the same uni, and they're not breaking their circle to someone else to enter into it.
Yeah.
But we did manage to find a little small hole to go in there and then talk to them.
Understandable.
I do have a lot of friends. Yeah, Filipinos, Kenyans. Yeah, are they from Kenya? Yeah, I think so. Yeah.
So now that's the last kind of part. So advices for future nursing students. What skills that you think students should develop before starting the course? if you want to mention something.
Na dil pakka karke aana.
Strong heart.
You need a strong heart
And
to be a nurse, because there's a lot of things that
Syringes.
there's a lot of things you're gonna face. There will be patients, there will be residents that you love. They're gonna pass away. They're gonna leave this world, and then that can leave you in depression. I have experienced it. That's why I got a bit emotional. But yeah, that's the main thing. Yeah, communication, make your heart strong, and your theoretical knowledge. You need to have that. Yes.
would you recommend nursing for someone purely aiming for PR, or should they actually have an interest?
Nursing, it's not easy. I have seen, like in my first year, I have done the first semester. In the second semester, there are a lot of students that dropped out. And then after, when I came to second year, they dropped out. A lot of more students dropped out because they couldn't handle. They're like, it's too much pressure. They can't see these things. They can't do these things. They're like, I don't want to do this. It's just a bit disgusting to them. Like, there's a lot of things in nursing, like, how can I say this in a nice way? You have to help them with their ideals, with the activities of daily living. You have to give them showers. You have to get them clean, and you have to get them changed. Some people can't do that.
So it just looks fascinating, but it is actually challenging.
It is challenging. Yeah.
Makes sense.
If you have interest, you'll love it.
What's the one wish that you would be knowing before you started? Any wish that you would be... What's the one thing that you wish you knew before you started this course?
That it's going to be intense, and I'll see a lot of things.
And
I wasn't prepared for it. Everything just came in like...
Life happens,
boom.
you know, when, especially in Australia as an international student, things may change.
Plus
like
emotions.
Anything.
Yeah.
When I'm an emotional guy, I just don't sound like, but I'm an emotional guy. So if I'll see someone breaking emotionally and mentally because of the health problems, or someone is dying, I can't maybe see that. So
And one thing, you need to have patience.
Any day.
You
Not only
need to
just in
have
nursing, I'm saying
patience.
any study, in any course, if you're in Australia or if you're in anywhere in the world, you need patience, right? It doesn't happen this way.
The people out there, they are bipolar.
I know.
They'll be very nice to you one second, and the next moment they're there to slap you.
Damn.
I'm not scaring you.
Any myth that you want to burst out? That's the last question. Any myth that you want to burst out about nursing?
A myth that it's easy. It's not easy.
Thanks. It is. I used to think this, but now I agree with you.
I have seen myself struggling. I've seen my friends struggling. I've seen a lot of them fail too. I was almost on the verge, but I saved myself. But
Strong, independent women.
it's it's a bit intense. Yeah, it's not easy. It's not easy.
So it's not the question. It's the last part. Rapid fire. City hospital or regional hospital? What would you choose?
Regional
Theory or clinicals?
clinicals,
Day shift or night shift?
night shift because there's no management there.
PR or passion?
Passion,
One word to describe your nursing journey yet.
roller coaster.
Nice answer. Okay. So, first of all, thank you so much for being
You're
and
welcome.
coming in this podcast.
Thank you for inviting me to this podcast.
And thank you guys for seeing till here. If you need more information, if you have questions, comment them below. And if you have actually urgent questions, I would love to give your LinkedIn, Instagram, whatever is fine.
Yeah, my Instagram's fine.
So I'll give that in the description. And if you have any questions, just DM her. And I would say just don't write hi. Just write a proper
Yeah,
message.
just
so
write
that
the
she
proper
can,
message.
yes, so that you can see, okay, that's what he's or she's asking.
Yeah,
And whenever you're free, please reply to them whenever it's possible.
I'll definitely do it.
And
I'll open my account then.
like this video, share this video to someone who's thinking to do nursing in maybe some other universities or maybe someone in the future. Subscribe to the channel for more videos. And this KapsLock. Follow me on Instagram if you have anything or you want to know what I do daily. Like, share, subscribe. See you guys.
Bye.